Good morning, everybody. Dr. Dave Marquis here. It's Friday morning, March 26th, and I'm not in the office today, but I did come across an article last night that I wanted to share with you. It's one that gives us more hope, and I'm really all about sharing positive thoughts and avenues that you can work to find resolution for yourself and for your family relative to the predicament that we collectively have found ourselves in currently. The article was written by Dr. Shiva Ayyadurai, the article was a summary of a letter written by Dr. Shiva Ayyadurai, and the letter was one that he had written to the White House to share his thoughts on how to address the whole coronavirus concept. I wanted to give you a summary of that and a little bit about Dr. Ayyadurai. He's a MIT researcher, and his specialty is in systems biology. And in short, his whole study has been one of the mechanisms of how to get into and out of biological cells. And he has produced some pretty impressive research over the years, and I was thrilled to see some of the concepts that he shared in regards to this particular virus. He took the country at large and broke us into 4 categories. And in a nutshell, those 4 categories are those individuals who have tested positive but are not hospitalized, those who have tested positive and are hospitalized, those who are immunocompromised but have not tested positive, and those who are healthy but have not tested positive. And then he laid out a protocol for each of those 4 groups. The general concept that I really found to be fascinating is that he was educating the president and the members of the White House staff on the importance of immune modulation, the very same topic that we've been sharing with you all along. Because the mode of action of this particular virus really is one of taking advantage of those individuals who already have an autoimmune shift or are immunocompromised such that their immune system would overreact by creating this cytokine storm. Now, when you hear about healthy individuals coming down with the virus and having a poor outcome, I don't have the data on these particular individuals, but I'd be willing to bet that they had or were dealing with an unknown autoimmune trait where their immune system was already on the verge of not being able to recognize self versus non-self in a healthy manner. I see these patients come through my door daily, and so it does not surprise me that there's people walking around that think that they're well, but they're really not. That being said, the solutions that I've been sharing with you via video and email over the past 2 weeks are still consistent, utilizing the micronutrients A, C, D, zinc, glutathione, and the other day I produced a video on the use of ozone in the incidence of actual infection. Those still stand 100%. And I found it interesting in Dr. Ayyadurais' video that he actually upped the short-term dose on the vitamin A in particular. So I didn't want to make this a long video per se. I just wanted to convey some more hope and share with you that there is becoming a larger movement and recognition within the medical community, including this researcher from MIT, that are understanding that, hey, you know what? We really got to re-regulate our immune system. And as a patient of mine, you already know that. So I'm hoping that you're each taking action and that you have the materials on hand, the glutathione, the D, the zinc, the ozone, the A, to respond to this appropriately. As an aside, putting the metabolic aspect aside in terms of micronutrients, please make sure that you're getting outside and exercising. We really need that opportunity to move our joints, to get our heart rate up, to exercise our respiratory system, and to release those endorphins. That complement of activity really does have an immune neutral or immune modulating impact on us. It releases natural growth hormone, nerve growth factor, and it helps us mentally to deal with all the stressors of trying to work through this process. I'm very optimistic that we collectively will be getting back to work soon and to a more normal state. I'm sure that there's going to be some things that are going to be the new norm, unfortunately. But I also think that on the backside of this, we're going to come out better off in many ways, because we're going to start understanding our own immune systems and how to work with them more efficiently. And also, I hope that we enjoy more of our collective humanity, and we can be nicer and loving to one another. Thank you for listening to this. I really appreciate each and every one of my patients and the trust that you put into my office and myself. We strive to do our very best to provide information in an accurate manner and in a timely fashion, and we will continue to do so. Have a great day and a wonderful weekend.